Hello everyone, this is Healthcare Disparities 1000. I'm your host, Guthrie, and here are our contestants.
Hey, I'm Chelsea.
Hi, I'm Eboni.
Hi, I'm Yerta.
Okay, audience, on today's show, we're going to discuss healthcare disparities, and our contestants have a chance to win $10 million. Woo!
I know I'm winning that money.
Okay, folks, for our first question, we have African Americans or Hispanics who is most likely to be uninsured while living with chronic health conditions are condition 1.
African American?
I'm sorry, condition 1. That is the wrong answer.
Oh,
Condition 3.
Hispanic?
Correct. All right, for our next question is going to be Asian Americans or whites. Who is the least likely to seek mental health services, prescription medicine, and outpatient services? Contestant 2.
Asian American?
Correct. For our third question, who is less likely to seek serious mental health inpatient services, white or African Americans? Contestant 1.
African Americans?
Oh, I'm sorry, contestant 1, that is incorrect. Contestant 3.
Whites?
Correct.
Hi, I'm Ericka, and I'm your fun fact girl. Okay. 46% of non-elderly Black adults who do not have insurance report having one or more chronic health conditions. 18% of Asian adults with any mental health issue were least likely to use one mental health service. 7.4% of whites with a serious mental health issue are less likely to use inpatient services.
Roper St. Francis House Calls TV.
Some diseases have a greater impact on African Americans and other minority groups in South Carolina. Dr. Thaddeus John Bell explains what some of these are and how Roper St. Francis is trying to address these health disparities.
Among African Americans and other minorities, we have more cancer than any other group of people. We have more heart disease. We have more HIV.
Several factors contribute to these disparities, including health literacy, access to health care, and socioeconomic status. But Roper St. Francis is working to counteract them, and the first step is awareness.
The disparities affect a significant portion of the population of the people that this hospital serves. And so we are trying to educate, trust the medical profession. The second thing is to help yourself by educating yourself about some of the health problems that affect African Americans and other minorities.
For more information, call 402-CARE, and for more House Calls TV, go online to rsfh.com. I'm Angela May.
Roper St. Francis House Calls TV.
For our fourth question, this is a double dose of correctness. What race or ethnicity of women are affected by cervical cancer, and what race or ethnicity is most likely to die from cervical cancer? Ooh, contestant 1. Quick reflexes.
For the first part of the question is Hispanics.
Okay, you on a roll.
And for the second part, African Americans?
Correct. You get double points. Question 5. What race or class ethnicity is affected by HIV/AIDS the most? Contestant 3.
Would it be whites?
Sorry, contestant 3, you are wrong.
Ooh.
Contestant 2.
Would it be African American?
Correct. Woo! Y'all is tied. Who's gonna take the cheese in this next question? Question 6. What race/ethnicity of women is most likely affected by breast cancer? What group is most likely to die from breast cancer? Contestant 3.
For the first part, would it be whites?
All right.
And for the second part, would it be African American?
Correct. You got the daily double. You're in the league now.
Woo! With 45% of HIV diagnosis, the case for African American adults and adolescents is 10 times greater than for white adults and adolescents. Okay, notably, non-Hispanic white women have the highest incidence of breast cancer, but African American women still have the highest mortality rate for this disease among all race and ethnicity. Diabetes is 60% more common in Black American than in white Americans. The excessive amount of sugar and fats are killing the African American community.
For our seventh answer, who is more likely to die from chronic disease such as diabetes? African Americans or Caucasians? Contestant 2.
Would it be Caucasian?
Oh, I'm sorry, contestant 2. That is incorrect. Ooh, contestant 1.
African Americans.
All right, that is correct. Woo! Our eighth question. Who is more likely to face mental health conditions, men or women? Contestant 2.
Women?
Correct. Next question. Who is more likely to have sexual transmitted disease and or depression? Contestant 3.
Gay men.
Correct. For our final question, question 10. Who is less likely to have access to health care in rural locations? African Americans or whites? Contestant 2.
African Americans?
Correct.
I've got an idea that's very simple. When a doctor walks into a patient's room to introduce themselves, "Hi, my name is Dr. So-and-so," and reach out and shake that person's hand and give them eye contact and ask them what's going on. Again, keeping the eye contact. It's just good listening skills. Show the patient that you are listening.
I definitely think that not only the doctor should be well trained in cultural diversity, but the staff as well, because that is the first person who encounters that patient coming to the counter. And if they don't know how to handle that patient, believe you me, they will not come back.
Trying to hire bilingual, bicultural staff, I think, is one of the more successful ways or the most practical ways to try to avoid the problem of miscommunication.
Often I add questions from what's called the explanatory model of illness. So some of the examples of these questions are, what do you think has made you ill? Have you consulted anybody else besides me for this illness? For example, family members, traditional healers, someone else in your community. What do you fear most about your illness? Which I really think gets a lot of good answers and helps you understand how the patient is thinking about it and what they're afraid of.
Women are 40% more likely than men to develop mental health issues. Women are approximately 75% more likely than men to report having recently suffered from depression, and around 60% more likely to report anxiety. Higher rates of HIV and STDs among men who have sex with men increase a person's risk of coming into contact with an infected partner and becoming infected themselves. African Americans are less likely to have access to health insurance if living in rural areas.
All right, folks, that brings our show to an end. We have contestant 1 with 4 points. Woo! Contestant 2 with 3 points. Woo!